All right, today we're doing chapter 13. It's about money. Money, money, money. Well, I guess first we should talk about how you pay. What do you do when you go to a doctor's office? What do you pay?
Copay.
Copay usually. What if you don't have insurance?
Usually pay up front.
All your bill has to be paid up front. When you come to our office, if you don't have insurance, you pay $237 before you even walk in the door.
That's an odd number.
That's what they figured it to be. So first off, you need to make sure that you're obtaining accurate patient information. You need to make sure that you're getting the right insurance company. Most of your insurance cards on the back of it are going to tell you how much you need to pay a copay. There's a different copay for a specialist versus a primary care physician. Usually it's $20 to $25 difference. So you need to make sure that you're getting that right information. You need to make sure you have the correct address, apartment, phone number. Why do you think those are important? As far as money goes.
Well, it's tracking them. You
Yeah.
can track the individual stuff.
Right.
So they owe more.
Right, if you have a problem with the payment, you know how to get a hold of them properly. If they refuse to give you any of that information, what do you think you can do?
You don't pay cash, maybe they can't receive.
They have to pay cash. They have to pay up front for their services. They don't get the choice of just not paying. Make sure that you update all their information regularly. In your book it says changes can be made in red ink. More than likely you're just going to make those on the computer. You make sure that you're checking their insurance card every time they come in. What if it's not valid anymore and you didn't check it?
It's on the office.
It's on the office. That means that office has to eat that fee for that appointment. All right, fee schedules. These are based on specialty, education, location, rent, utilities, taxes. What that means is you have a fee schedule for your office. Maybe you work in a dermatology office, so your fee is going to be a little bit higher than what it would be in a family practice office. It's based on the education of the provider. A PA, a physician's assistant, is going to charge more than less than an MD, a medical doctor. Based on your location, do you think it's more expensive to go to a clinic in Omaha or a clinic in Harlan, Iowa? Where?
I know how much cheaper.
Actually, it's cheaper to go in the rural areas. They don't have to pay as much for their rent. They don't usually have to pay as much for their utilities, and their taxes usually aren't as much as a metro area. So normally the bigger hospital you go to, or the bigger clinic you go to, the less your fee schedule, or the more your fee schedule will be, because they accrue more costs in their clinics. You'll have a typed list of your most common services with their code numbers, a description and price. What this means is, okay, you have, has anybody seen a super bill at your office, how they actually charge you when you go to the doctor?
A whole bunch of codes that are.
If you look on page 422, that is an example of a super bill. You'll see they have a code there. So let's just look at the first one. It says level, under office visits, blood pressure check. 9921 is the code. So that is the CPT code is what we call it. That's how they're billed. That's how you bill people, is through those code numbers. These don't have a description of what it is, but you'll be able to find that somewhere in your office. Normally, like, our coders have a book that tells them what each level is of their descriptions of their codes. And then you'll have a price there. This one doesn't have prices next to it, but a lot of them do. So you'll see this person was billed for level 3. The fee for that is $70.92. And the levels are based on what type of service that you're receiving from the doctor. This list has to be available to patients. You have to use this list if you need to quote a price. You always quote a price. You never say it will be this price, because what if they have maybe they have a level 3 office visit, but you also have to do a mole removal while they're there. You're gonna have to charge 2 separate things. So you never wanna say it's definitely going to be this price. It may vary according to insurances. Blue Cross Blue Shield customer may pay less than a Midlands Choice customer, just based on how much their insurance is going to pay per office visit. And some offices might charge you for a phone call, a nurse visit, or a no-show. Like we talked about, I think we talked about this in an earlier chapter, if you call in and they give you medical care over the phone, they may charge you for that. They may charge you if you come in and just get an injection. The injection fee in our office is $46, regardless of what you're having injected. If you're just coming in for a tetanus shot and you don't see the doctor, you get charged $46 just for the injection. And no-shows. Some offices might give you one freebie. After that, if it's set in their office policies, they can charge you if you don't show up or call. Patients. Medicare fees. On page 416, it starts to talk about Medicare fees. There's a participating fee. This is the amount paid to the doctors with contracts. So that means people that, this is going to get huge in about a year. People that are contracted through Medicare, they meet all the standards of the Medicare requirements, they get paid a certain fee. Non-participating fee is the people that don't have contracts with Medicare, that don't meet all the standards that they're supposed to. There's also a limiting charge. This is the absolute highest amount that a patient can pay for any rendered service. So Medicare may cap a mole removal patient, most they're ever going to have to pay is $150. Even if it costs the office $750 to do it because maybe you had to do multiple moles or they had to do multiple tests on it, the office will have to eat what isn't paid out as their limiting charge. Does that make sense to everybody? A limiting charge? Okay, fees and discounts. If you have to change your fees, obviously you're going to want to notify your patients, hey, our normal fee is going up or very rarely going down. You want to make sure that you make them aware of that. They need to know that you're going to change the prices, especially those people without any type of insurance. You can have a hardship discount. Anybody have any idea what this is? Kind of like a sliding scale. It's dependent on your income levels. So maybe you have a person, anybody go to the Omni Center here in town? Is that to the Council Bluffs clinic there?
I have.
That clinic is solely based on your income. You only pay as much as you can afford, according to them. So if you are not working and you don't have insurance and you go in and you have a procedure done, it's going to cost you a lot less there than it would at another office that doesn't have a hardship discount like they do. A lot of those clinics have a lot of government funding behind them. The Hill-Burton Act, this is assistance for, well, this is how it came about. It would be assistance for construction and return of care of indigent patients. Anybody know what an indigent patient is? It's a person that needs medical care but is not eligible for state aid. So a lot of these would be students that their parents can't have them on their insurance. Those people still need medical care, but they don't qualify for Medicaid, or they don't qualify for, maybe if any of you have heard of a program called Hawkeye, or there's another program here in Iowa called Iowa Cares. If you don't qualify for any of those, you're an indigent patient. So what the Hill-Burton Act is you can trade a service for medical care. So maybe you go into an office that needs some reconstruction in it. And you say, hey, I'm having this problem, I need it taken care of. Can I trade you my service for your service? Kind of like bartering.
Do you really do that?
Not really a lot anymore.
Sounds
Because what do you think the top thing is that gets you in trouble there?
sex.
No. No.
What'd she say?
Sex.
Oh.
No,
That's
there's
what I
no
think of when I think of that.
trading medical care for sexual favors. That gets you in trouble.
Well, that's what you have?
No. Lawsuits can happen here. You say, doctor says I'll do this, and you'll say you'll do that, but then maybe you don't follow through on your request, or the doctor doesn't follow through on their request. There's a lawsuit right there. So a lot of times this is not used. You may find it in rural communities, but in a metro area probably not. A professional courtesy. Anybody know what a professional courtesy is?
No.
You're a really good reader. What this is a discount that's given to certain people from the doctor. Sometimes a doctor will know of a family that doesn't have any insurance and they will no charge, is what they call it, that patient when they come into the office. Sometimes a doctor may set up a deal with another patient. Maybe they're doing all their yard work for them. So that doctor, when they come in, they waive their copay. Something like that. That's what a professional courtesy would be. Or other doctors extend that courtesy to other medical professionals a lot of the time. Like when I take Natalie into my office, my doctor doesn't make me pay my copay. I just get to take Natalie in there because that's one of my perks of working in my office. That's one of my professional courtesies. A copayment waiver. This used to happen a lot in the past. They don't do this anymore. It's actually banned. It means that you're not treating all patients equally. So you can't just automatically say, we're going to waive your copay. You have to give that, what we were talking about, the professional courtesy. That's what you have to file it under. You just can't say copay waived. Discussing fees. Who do you think gets to discuss fees with patients? Receptionist, maybe? Who else? Doctors do not.
Insurance.
Sometimes insurance, well, after it's already been billed. A lot of times you may be the one that has to tell them that. For instance, our sleep study center makes you inform the patient up front that if they don't show up for their sleep study, they pay $300 out of pocket. You have to tell the patient that. Do you think that's fun? Do you think the patients get mad? How do you think you need to discuss fees with patients? Should you do it out in the lobby? No, you need to do it in private area. You need to explain that fees are collected at the time of service. Like we talked about before, you need to post all the information for the patients to be aware of what your fees are. If they have insurance, you need to at least collect a copay for every visit. What do you think are things that are different, that you don't have to pay a copay for every visit? That is all billed in all one lump sum. What kind of office might do that?
One lump sum.
You are just billed one lump sum and you pay maybe a percentage of that.
A dentist.
Dentist office might do that. OB office does that. You don't pay a copay every time you go see your doctor when you're pregnant. You actually pay a percentage of your total cost of your pregnancy. A lot of times when you start talking fees with patients, they're going to want to talk about how their health is, how their health is affecting maybe their income. You need to be prepared for that. prepared how you're going to answer the question of, well, due to my illness, I'm not able to work. How am I supposed to pay this? What do you think are some options that you can have for that patient? Somebody besides the front row. Shh, you're in the front row. What do you think? Options for patients that can't pay bills. What can they do? What are things that you could offer them? You should have talked about this in jurisprudence, maybe.
Phone number to call? Like a place for them to call?
A place that they can call. Give them a pamphlet about a community resource. Have you done community resources in jurisprudence?
No. Yes, we have.
Don't you have like a whole paper due on that pretty soon?
It's like due Monday.
You need to have that stuff available for people so they can sit down. They say they come to you and they're crying because they can't pay their medical bills and they keep stacking up and stacking up because they have a chronic illness. Be able to help them. Don't judge them because they can't pay or because they don't look like they can pay. You need to be able to help them out. Make them feel like you're there for them. You're not there for the hospital or the clinic. Communicating fees. I'm on page 419. It's all kind of communicating, discussing. They're kind of the same things. Make sure that you're positive about what's happening. I mean, you don't have to go in there and say, hey, you owe us $500. You know, hey, Mrs. Jones, looks like this is the procedures you've had done. Our fee for this service is this much. Don't be hesitant about it. You're telling them a fee amount that's already set. It's posted. They should be aware of it. You should be able to discuss it with them. Sometimes you have to offer a payment plan. Even if they have insurance pending, they can start monthly payments right away if they're going to do a payment plan. Say you have your gallbladder out. You know it's going to cost you a certain amount. You haven't met your deductible for the year. There's absolutely zero reason that that patient can't start making a payment before their insurance goes through. They're going to have to pay some amount, regardless of what the insurance pays. Get a $25 payment that day, if you can. On page 420, it talks about signals of a deadbeat. A deadbeat patient. What do you think a deadbeat patient is?
Oh my gosh. A bum.
A bum?
Somebody knows not gonna pay.
Somebody you know is not going to pay. They walk in the door, you know they're not going to pay. What do you think are signals of this? And I know you're just going to read from your books, you might as well.
They have a motel address.
Motel address. They have several different employers in the last 3 or 4 years.
Instead of bar hopping, they doctor hop.
They doctor hop. You can tell that they've been to maybe 3 different doctors in the last 3 months. Something's going on here.
No insurance would be.
They don't have any insurance. They leave a lot of blanks on their forms when they check in.
Maybe there's nothing you can do about it. About a deadbeat person killing.
Kind of.
You can't.
You can. If they refuse to give you anything up front, you can say you cannot be seen. If you need emergency care, here's how you get to the closest ER. In a doctor's office, you have the option of saying that. In the ER, you do not. You have to treat if it's an emergency. Okay, billing. Again, try to collect your payment at the time of service. You want to take every opportunity you can to try to collect money. That's why that's almost the first thing to ask you when you walk in the door of your doctor's office. Can I have your insurance card? I need your copay. Are those the first 2 things you guys get asked?
You. What an answer. Or how can I help you?
How can I help you?
I know the video.
Hi, my name's Emily. I'm here to see Dr. Smith. Emily, can I see your insurance card?
Yep.
Right?
And I need your money.
Yep. Oh, looks like you have a $25 copay. Can you pay that today? Almost always. I hear that 500 times a day. Maybe not 500, maybe only 100. But the collection ratio. Anybody know what collection ratio is? This is your money owed versus your money collected. So if you owe $500 and we've collected $100 of it, what's your collection ratio? Anybody know how to figure it out?
100 to 5. 100 to 500. 400.
100, 500 to 100.
Yeah.
So that would be your collection ratio. What percentage of that is paid?
10%. 15%. I don't know. I don't do math.
100 out of 500 would be
25.
20%.
Yeah, 20%. I was
Maybe
close.
they-
I went 15 to 25.
So your collection ratio on that debt would be at 20%. Obviously, face-to-face collection is going to be the most effective way. If you continue to get a letter in the mail, you can throw it in a pile. You don't have to think about it. You can ignore your cell phone. How many of you ignore your cell phone when you don't know the number? You think if they leave you a message on an automated thing, you're going to call them back?
You don't have to set up.
I know if I get a call from a number I don't know, and they give me an automated message, they can't even take the time to sit there and leave me a message on my phone, I am very unlikely to call them back. Especially if it's a political person. Also, I want to say on this one, you can say something about that outstanding balance before the patient is seen. Hey, Mandy, sorry, I wanted to say Megan so bad. Looks like you have a $150 balance with us and you'll have a copay of $25 today. How much of that do you want to take care of?
No.
You don't have to say, you have to pay your $150. You can say, hey, this is how much you're going to owe today. You already owe this much. Did you want to pay a little more?
What if they say no?
Okay, I'll take your $25 copay. Most clinics, hospitals, businesses in general are going to have a department that's in charge of getting a hold of those collections. A billing department. Multi-purpose billing. We're on page 422.
21.
Okay. This is what I was talking about, the combination bill and a super bill is what we call it. They use a lot of different terms in here. Charge slip, communicator, encounter form, fee ticket, patient service slip, routing form. All of these things are the same thing. They're all a multi-purpose billing form. This code has the codes on it, the fee on it. Sometimes it'll have the patient's next appointment date on it. Like I said, page 422 has an example of this. Has patient's name, date, the date the services were rendered, their date of birth. It's located on the front of a patient chart. A lot of times what happens, well, at least at my office, I'm sorry I keep using that as an example, but that's what I know. When they check in, we'll get stickers. We take those stickers, we attach it to a super bill. That's how we code that appointment. We'll have this sheet, we'll go in, I'll take this in and stick it in there. When the doctor's done, he'll go through and say, okay, I'm billing at a level 3. We also gave them add a cell, so we circle that. And then on the back of that sheet, which down here on this one is where it is, has your diagnosis codes on it. So we billed this person a level 3, and this is why they were billed a level 3. On here, it's a UTI. You see that? So you have to tell them why you're billing them that amount. See how those correlate? Both the doctor and the medical assistant can be responsible for doing this. Doctor's going to be responsible for billing them their level. You're going to be responsible for billing them for their injections, or maybe you did a nebulizer treatment, or maybe you gave them packing for a wound. You have to charge them for those supplies. Monthly statements, what's a monthly statement?
How much you send out each month, and how much
How much you owe. What else does it have on it? Usually the first one you get after your services are rendered, what does it have on it?
Yeah, it's sometimes,
It's a statement of what was done.
yeah.
So if you went in for a doctor's visit and you had, maybe it's you have a kid and you have a 15-month-old child, check. So you go in and you'll have, on your statement, it'll say the date of service, so 10/30/12. This is the DOS. And then services rendered. So maybe this is a well baby check, and then it has a price. And then maybe you had an MMR, and this is the price. And a varicella, and this is the price. And what else do you get at 15 months? Pentosil, and this is the amazing price of Pentosil. And maybe it's that season, so you got a flu shot too. So you got $60. Now, each one of these is an injection, so what else do you have on top?
You have an injection.
Injection fee times 4.
What?
So injection, 4. Let's say it's $25 for your injection fee, so you got $100 there. What else is going to be on your statement?
The doctor, can you do that?
Yep, well baby check, there's your doctor's visit.
I gotta take that. Show your copay or whatever you pay.
Payment. And this is going to be in a different color, or it's going to have a negative in front of it. So this will be like this. Negative $25. And usually this will say like copay behind it. A lot of times, what else does it say at the bottom of there?
How much your insurance?
Insurance pending. Doesn't mean that you can't pay for it yet, but that way you know they haven't gotten any insurance payment for this yet. This all may not be your responsibility. Also, your total is going to be down here. So they'd add all of these up and take out your $25 copay. Expensive.
That's why like my daughter's.
Immunizations are ridiculously expensive.
Your insurance is all covered up?
Yeah, they do.
A portion of it, depending on what insurance you have.
Yeah. Most insurances will cover for all of it, unless they're unnecessary immunizations. Some insurances now will cover for Hep A, some don't, because it's not required by the state. But it is one that they recommend you get, especially in this area because we have a lot of flooding. This is also called a ledger card. Shows your charges, payments, adjustments, balance owed. This can list one patient, or if you have a family of 4 or 5, it can have all of you on it. Shows delinquencies. Okay, so maybe this is on the first page of your statement, and then on your second page, it has numbers that look like this. Anybody know what delinquents are? It says 30, 60, 90, then it usually jumps to 120. So you have that there too. What do you think these are?
Dates.
Days.
Like how many days?
How many days out you are. So if your services were rendered, let's say they were rendered in July. So 7/1/12. How many months ago was that? 3 months? How many days? 90 days. So you're 90 days out and you still have a balance of $120. If that's what your balance due is. That's what that is. That's called your aging analysis. Anybody know what a done message is?
It's like a statement reminder everybody.
Yeah, yep. It's a message on a statement to promote payment. A lot of times it'll be in big red letters. It says past due, please pay upon receipt. If it's that far past due, you may have a little love note in there that says, we're sending you collections if you don't pay this in so many days.
Will they usually send you to collections even if you are at least sending in some money?
No,
They usually won't.
they usually will not.
They sent me and I was paying. I just wasn't paying full.
Really?
Yeah.
Very nice.
I know. I was like, Mom.
Usually, doctor's
It was
office
like
is pretty.
$100.
Usually, they're pretty lenient on that. As long as you're paying them something, they tend to go with the flow.
It was Jenny too.
Oh yeah, they're bad about that. Cycle billing. What this means that certain amounts are billed at designated times. So this may be based on your last name. Maybe A through F is billed on the first of the month and G through Z is billed on the 15th of the month. Could go by your account numbers, could go by your insurance. Maybe your hospital has it set up that they get their insurance payments from Blue Cross Blue Shield on the 15th, so they bill you on the 1st. So they know that they got their insurance payment, now they know what they have to bill you instead of sending you out two separate bills, one pending insurance and one not. This promotes a continuous cash flow throughout the month, so you're not receiving a lump sum of money on the 1st and you don't have anything coming in the rest of the month. Credit cards. How many of you have a credit card that you can use for your medical expenses that is promoted through a doctor's office?
Yeah, Blue Cross Blue Shield has one of our process for like medical, like for prescriptions.
This can permit a full or partial payment. The office is actually charged a monthly fee to obtain these credit cards. So the service that they're providing to you is costing their office money. It's usually a percentage of the charges that are submitted. So if a patient has $700 of charges for that month, 5% of that may go to the credit card company for the services that they're providing for your office. This credit card number is usually kept on file in your doctor's office with your insurance information, your financial record. So what do you think the downfall of that is?
If you don't pay, they're just gonna keep tacking it on.
They're just going to keep tacking it on. They already have that information. What stops them from continuing to charge that card, regardless of whether you think that's okay or not?
Or if it's maxed out.
It's maxed out. Yeah. Credit and collection laws. How many of you are familiar with the Fair Debt Collection Act? Anybody know what this is at all? I'm on page 431. How many of you, nobody has any idea what this is. How many of you have a credit card?
Me.
Only one of you has a credit card? Really?
I have like 3.
I find that hard to believe. Okay, what this means is that this is an act to protect you as a person with credit. The company is supposed, whoever owns your credit card, whatever company that is supposed to follow these rules. I'm not sure that they all do, but they're supposed to. They can only contact you once a day. If you're past due on your credit card, how many times a day do they contact you? Ever been past due, Emily?
No.
I would say maybe 4 or 5 times a day they contact you.
Past due on paying it?
Right.
That's why I don't have it.
Calls have to be placed between the hours of 8 a.m. and 9 p.m.
9 p.m. That's late.
Imagine if you have a kid that went to bed at 7 and they called you twice between 7 and 9. Yeah.
It ends early too.
They're not supposed to be able to contact you on Sundays. Or maybe if you're a Seventh-day Adventist, that's your Saturday is your Sabbath. They're not supposed to be able to contact you on that day. They can only contact you at work if attempts to contact you at your home or cell phone are unsuccessful. And if your employer disapproves, they cannot contact you at all. If they call you at work and you say, hey, I'm getting in trouble at work because you're calling me here, they're supposed to stop calling you at work.
It's only you have your own business at home then. So they can call you at home.
They have to identify themselves and the medical practice they represent. Once it has gone into this process, the physician or the representative for that physician cannot give any messages to the debtor about their debt. Has to go through this company. Contact must be made through an attorney if an attorney represents the debtor being the person that owes the money. Medical assistant can contact other people for tracking purposes only. So if you have a person that you cannot get a hold of, you may contact their emergency contact. Anybody that they have listed on their chart, you can contact them. You can't send postcards. You can't threaten or use obscene language. Or you're not really supposed to bully. They say, hey, we need you to pay this much a month. If you can't, we're going to do this. You're not supposed to be able to do that. Collectors are obligated to send the patient written verification and the name of the creditor and the amount of debt. So that's your fair debt collection practice. Does anybody have any questions about it? Basically what it is making it so you as the debtor are not harassed.